So what exactly happens in MS? What are the symptoms of multiple sclerosis? Now, depending on where, like I said, where the lesion happens, different parts of the body are affected. In my case, ladies and gents, I presented with every one of these symptoms. Starting at the top, the patient is filled with fatigue. There's cognitive impairment, severe depression, unstable moods, optic neuritis hits, problems speaking, which is very common with MS patients, problems swallowing, there's weakness in the muscles, there's muscle spasms, there's loss of balance. Previous to my diagnosis, I used to bump, I used to miss the door, I used to hit the wall, but I never told Dr. Sakura that I didn't know it was a symptom, I just thought I just missed it, and I was so fatigued. Now, one thing I didn't mention right now, before the diagnosis, I was an extremely healthy human being, going to the gym, partying, very active, doing lots of stuff. And we had an incident where my house was flooded out completely damaged. And I had to work with our insurance companies, and I'm sure you all know what hell that must be. They promised me that my house would be ready in 2 weeks. It took them 4 months. And they kept fighting with me, not wanting to do the job, not wanting to pay for it. And I was left in charge of getting that house back in order. We had nowhere to sleep. We were going from B&B to B&B all the time because they kept promising us it was going to be better. And it was quite traumatic for me to work with them to get the house sorted out. And as soon as it was done, I started presenting with symptoms. So it was 3 months of symptoms before we did an MRI and then discovered it as the MS that is doing it. There's pain and extreme pain, tingling throughout the body, and I presented with this. It was a burning sensation from the top of my head to my toes. I had diarrhea and constipation. It went from one to the other. Very common in MS patients is incontinence. They really battle with it. When I'm working with the MS Society, the number one thing that they look for is the nappies, because patients really battle there. And like I said, with primary progressive MS, patients that have these symptoms, they stay with it for the rest of their lives. Now, I make no apologies for how busy the slide is, because I was riddled with symptoms. Now, you look at all the symptoms I just described, and you've got to add to that Hashimoto's, you've got to add fibromyalgia, you've got to add in the rheumatoid arthritis. I could not believe a human being can have so many symptoms all at once. Now, in terms of the RA, 6 months before my diagnosis, I ended up with posterior tibial tenosynovitis, my right ankle. And that's where we picked up that, there's a chance I could end up with RA. But I didn't present with any other symptoms, no pain in any of my joints, so I just totally ignored it. But when we picked up the MS and we did the bloods, the RA, it just seemed to exacerbate the RA. So my joints were inflamed. My ankles were inflamed, my hip joints were inflamed, the knuckles were inflamed. There was just pain throughout my body. And in the hospital, we started with the solumedrol immediately upon diagnosis, and then we started the methotrexate. I was in absolute pain. It did nothing for me because the symptoms were still there. The medication that I was taking, I really looked like this guy down here, because I had medication for every symptom that I was presenting with. And having Rajan there, I would phone him and insist that he contacts Dr. Sakura. I need another script. The drugs that came home were not working. I want something else, because I was desperate to get better. And of course, all this disability, the loss of functionality, depression set in, mood swings set in. Now, what's very interesting here is that all these symptoms are exactly the symptoms that are listed on the package insert for solumedrol. So when I came home presenting with the symptoms, we had no idea whether it was a side effect of the solumedrol or whether it was the condition that I was diagnosed with. So let me paint a picture of what it really felt like having this diagnosis. I experienced headaches like I had never experienced before in my life. It felt like rocks were being pounded at my head. Rocks were being thrown at me. With the tingling that was going throughout my body, it was a sensation of my scalp being torn out of my head. It was that painful. Nothing subsided that pain. It doesn't matter what drug Rajan brought home. I had to sleep with an ice pack under my head 24/7. For me, it was frozen sweet corn that I had under my head. If you felt my head at any time, it was still so hot. I don't know what was happening to that coldness. It was just sucking up the coldness from the ice pack. I battled to sleep at night because I was just in pain all the time. I experienced what is called an MS hug. I don't know who called it an MS hug. It should be called the boa constrictor, because this is a crushing pain of the rib cage. Breathing in and out was such a difficult thing for me to do because it was just pain all over. For I think an entire year I couldn't wear a bra. It was just so painful all the time. I experienced what is called Lermit sign. This was picked up in the hospital on my first visit. What this is a burst of pain that runs down the spine into the legs every time you bend your head. And when I asked my doctor, when will this go away? He said, no, because the lesion in the spine, it will never go away. So I said, how do I stop this? He said, well, all I can tell you is you need to try and not bend your head. And that was so difficult to do. The pain, numbness, and tingling throughout my body was constant. There was severe loss of balance, vertigo set in, so there was nothing I could do for myself. I was losing my independence very quickly. The nausea and vomiting, of course, accompanied this loss of balance and vertigo. Just the trip from the hospital, from the house to the hospital, Rajan had to stop the car to allow me to vomit. That motion was just an absolute no-no for me. I must tell you another incident that happened. When I was first diagnosed with the relapsing rheumatism, there was a period where, the symptoms you feel you're getting slightly better. And there was a time when I insisted Rajan take our children out because they were traumatized with my diagnosis. And he said, there's no way I'm leaving you alone. I said, no, when the kids leave, I'll take my stool knocks and I'll go to bed and I'll stay there till you come back home. He says, okay, I'm not very happy about it, but I'll do it. So he left the house with the boys and they actually went to Durban to watch a rugby game. My maid left, locked the door, and as I moved towards my bedroom, I had the sensation of wanting to vomit. So I moved straight to the bathroom. And as I reached the toilet bowl, I vomited. And a few seconds later, I vomited again. So I was kneeling down now around this pan. And then I tried to move because I needed to reach a phone. And my legs will not work. Nothing at all. I could move my hands. That was about it. And I knew there was nobody around. There was no way of me getting in touch with Rajan. And I sat there. And I was so sure it'll go away, it'll stop. It didn't. I wanted to vomit again. I was just heaving because there was nothing left inside of me, but there was a sensation to vomit. I couldn't move. I put my hand, on the bathroom floor, and I was lying there. Every, 15 minutes, I'd wake up and I'd want to vomit again. 4 hours later, Rajan arrived home looking for me, wondered what had happened to me, and ended up screaming for the boys when he found me lying on the floor. Carried me, gave me a shower, took me straight to hospital, and I was onto Solumedrol immediately. Ladies and gentlemen, a diagnosis of MS is a ticket to hell. The fatigue. The fatigue is like nothing I'd ever experienced before. It was difficult even holding my head up. There was absolutely no energy. My get up and go got up and left. There was nothing in there. Sleep did nothing for the fatigue. It was just there to stay. The difficulty swallowing, obviously I didn't want to eat anymore. The brain fog and cognitive decline left me totally confused as to what was happening. I was embarrassed because I had visitors would come in. I could not follow their conversations. Then I figured out, okay, if somebody smiled, I'll smile. If everybody was serious, I'd look serious. I'm lying in bed there, and I had to make sense. I was so embarrassed that I could not have a conversation anymore. And Rajan, later on told me, when the boys are there and we're trying to discuss school things because I was in charge of, sorting the boys out before the diagnosis. And he says he'd be having a conversation with me, and my response was just so irrational, and they'd all just go silent. I had no idea I was speaking in such confused terms. The weakness in the legs, the clumsiness, the bumping into the walls got worse. It got severe. I could barely get myself to the bathroom. You know, that lip of the shower, to lift my leg up and to go into the shower was impossible. I remember standing there staring at it and wondering, why on earth do they make it so hard, It was just so hard to lift my leg that much. This is just page 1. Now, another area with MS, it affects the brain, it affects the spinal cord, it very often hits the optic nerve. My right eye would go blurry, and the socket was extremely painful. It started in the hospital. I was already on solumedrol, and my eyes started going blurry. I must say, I don't think I ever prayed more than I did that night in hospital, because I knew I was going to lose my eye. Then there was just no more driving for me for the rest of my life. But the next day, Dr. Harrison examined me, and he said, no, the nerve has calmed down, so I guess the solumedrol definitely helped there. I had continuous tingling and burning of my tongue. This burning is like, when you have tea and it was way too hot and your tongue has that sensation of being scalded. That burning feeling was there all the time. After a dose of solumedrol, I came home with bleeding gums. My gums would bleed for weeks. I'd have to get Rajan up in the middle of the night to change my pillowcase because it was covered in blood. The puffed moon face from all the solumedrol was there. And then I experienced tremors. And this was terrible shaking of my head. And that left me even more embarrassed. With visitors coming, I could not believe how much my head was trembling. I looked like a Parkinson's patient there. The difficulty urinating, I had the sensation to urinate. I'll get to the loo, nothing happens. And I'll just sit there, and just dribbles will come down. The red inflamed joints. It was so painful, you didn't actually see it red out there. It was just pain all over. Even the solumedrol couldn't seem to calm down these inflamed joints. The persistent pain throughout my body, and when I was diagnosed with fibromyalgia, it felt like somebody poured petrol on this fire, because the entire body is inflamed. All these conditions are inflammation. And now you add fibromyalgia to that, that's inflammation of the muscular tissue of the body. So there I was, covered with pain, covered with discomfort, being bedridden. I was bedridden for almost 18 months. There were months where I spent more time in the hospital bed than my own bed at home. I discovered that the symptoms were much worse on a hot day. So I was very particular about staying under the aircon, but the symptoms were there, they were just not going away. Now, as much as Dr. Sukur allowed me to look to seek a psychiatrist, and because I could see depression was coming in, the Simgen, I think it is, that I used did nothing for me. The mood swings were like nothing my family was ready to face. I turned into an absolute animal at home. And nobody was ready for that. We didn't really understand the condition, where it was coming from. All the focus was that I need to make sure my legs were not getting damaged. It wasn't permanent. I was battling to move, but still, I started to get irritable. I was angry with Rajan. He wasn't bringing home the meds that I needed. So the depression got really, really bad. This condition robbed me of my vitality. It robbed me of my ability to be a mother, to be a wife. With all the tingling around me, nobody could touch me. Rajan would sleep on the absolute edge of the bed. Now, the one thing I became very, very good at was planning my suicide. I did not want to live like this, because everybody around me told me there's nothing they can do, there is no cure. Yes, Dr. Sukur and Dr. Mohammed were busy I'm trying to find out the best choice of DMD to give to me. But with all the pain that I was going through, being on the methotrexate, using the solumedrol, nothing was working there. Now what's quite interesting here is my mother, when she sees her doctor, she always likes me to come along because, we both hear the same story. And she had to visit her neurologist at Albert Luthuli Hospital and insisted I come. And I said, Mom, I cannot move. She said, no, I'll carry you. My brother was taking her to hospital. I'll carry you, put you in the car, and we'll put you in the wheelchair and you come listen. And I'm thinking, I can barely do anything for myself. How is it possible that I could be of any use to you? But nevertheless, I actually said a prayer. I don't know why my mom's insisting I go. And I went along. And sat in the wheelchair, head on the table, got in. And when her neurologist examined her and said, tell me, what is stressing you out? And she just burst out crying. And she looked at me. So he says, what's wrong? So I told him, my diagnosis, and I'm really battling with the headaches at that time. And he asked me a question. He says, tell me, did the headaches start with the methotrexate? And I said, I don't know. When I left the hospital, I used all the drugs and the symptoms just fired up one after the other. And when I came back and I spoke to Dr. Sakur, and I said, I really want to stop the methotrexate. And he said, okay, let's try. I'm still working out a DMD. We're looking at rituximab. And he says, I don't mind. You can stop it. And within a week of stopping the methotrexate, the headaches went away. So that was something very interesting, the way I responded to it. Now with the headaches, when they was really driving me crazy, we made contact with Professor Modi up in Johannesburg. And when he examined me, he offered me nerve blocks. He says, no, I will, I asked him, what is that? He says, no, I'll inject the anesthetic into your head and it will really help relieve that. So I said yes, having no idea what this was like. Oh my goodness, I don't know if any of you have administered this. It is the most painful thing somebody can experience to have it done. The nurse standing next to me, I squeezed the hand so tight I think it went blue. It is very, very painful. And after he finished the one side, he says, my girl, we need to do the other side. And he did. And this gave me 6 weeks of relief, and those headaches were back. This was before we figured out that it came from the methotrexate. So ladies and gents, when faced with all these conditions, all these symptoms, suicide really becomes the best outlet for an MS patient. When you look at the deaths of MS patients, suicide ranks above about 80% of the deaths come from suicide. Okay, for us, it seems like a very viable option. According to the American National MS Society, MS has the highest rates of depression amongst all disabilities, more than cancer, substance withdrawals, and epilepsy combined. That's a massive stat. This is what my brain looked like. This is what it felt like when I was trying to have a conversation. There was just absolute total confusion. With brain fog in MS, and it's called fibrofog from the fibromyalgia. And of course, I seem to have it all in there. I used up all my sick days, so I called in dead. Another problem that I faced is that a lot of my symptoms were silent symptoms. So patients would look at me, friends, family would come to visit me, and I'd be lying there in bed, and they'd go, but you don't really look sick. Why are you always so tired? You need to try harder. I have people telling me, thinking they're encouraging me, but that's the last thing you want to hear because I'm really trying my best in my heart. That's how I felt. The problem with autoimmune conditions, the problem with lots of chronic conditions, the hypertensive, the coronary heart disease, diabetes, you don't see the effects the patients are going through. These are silent symptoms sitting in there. And as you can see, most of the symptoms were silent symptoms. So this is a very, very difficult space for an MS patient to be in. And I'm not the only one. Most of MS patients are going through this kind of situations. And I think it's all patients with chronic disease. There is no wound to see there, you know? And so the people around you don't understand how difficult it is faced with these conditions. Now, ladies and gents, my doctors really, really tried to help.